Hello and welcome. I'm your host, Neil Howard, here on Health Professional Radio. Thank you so much for joining us again. In this segment, we're going to be speaking with Dr. Mark Lebwohl. He's joining us here as Dean of Clinical Therapeutics at the Kimberly and Eric J. Waldman Department of Dermatology at the Icahn School of Medicine at Mount Sinai. He's joining us to talk about the importance of early treatment for psoriasis to avoid future complications. During Psoriasis Action Month, Dr. Lebwohl wants to educate the public and encourage fellow doctors on furthering the research on topics surrounding causes, triggers, and treatments. Welcome to Health Professional Radio, Dr. Mark Lebwohl. Thank you for joining us this morning.
Delighted to be here.
Quite a position there at Mount Sinai. Give us a brief look into your professional background and talk briefly about your position at the Icahn School.
I'm Dean for Clinical Therapeutics, and I am in charge in that position of bringing in research in all areas, not just dermatology, to the entire Mount Sinai health system, which is an enormous and very productive health system. For the 24 years before that, I was chairman of the Department of Dermatology, and during that time, chair of the medical board of the National Psoriasis Foundation.
What is psoriasis? Who does it affect?
So psoriasis can affect anyone. It's a combination of genes that you inherit from both parents that essentially tell your skin cells to multiply too quickly. And on the first glance, it looks like a skin disease. But in fact, what we have learned is it has many effects on many organ systems. So a significant proportion of patients will go on to develop psoriatic arthritis. And a significant proportion of patients will go on to develop cardiovascular disease. Patients with psoriasis get heart attacks at an earlier age, for example. So it's a disease that has a lot of implications for general health, not just the skin.
When you say it can affect anyone, is that across ages as well, pediatrics as well as into your senior years?
Yes, the youngest person to get psoriasis was born with it. The oldest person to get psoriasis for the first time was over 100. Wow. So it can occur at any age. There are some peak ages. For example, the late 20s and the late 50s are peak ages, but it can start at any age.
It causes your skin cells to multiply too rapidly. Is there pain involved? Are there pustules, or are there anything like that? Is there itching, or is it just a visual sort of thing?
Yeah, there are different forms of psoriasis. The most common one is called plaque psoriasis, and it presents as these large areas of red, scaly skin. They generally do itch. They can be painful because the skin hardens and can crack. One patient has compared it to having a million paper cuts. So the skin can hurt, and pain is indeed a part of it, not just because of pain in the joints, but also pain in the skin. There are other forms that are less common, fortunately, because they can be life-threatening. One is called pustular psoriasis. The other is called erythrodermic psoriasis. But they are much less common than plaque psoriasis or the other common form, which is called guttate psoriasis.
These problems, these severe problems that are associated with the condition, do they only manifest if the condition is left untreated, or is this something that can happen even if treated, such as the early heart attacks, things of that nature?
So we have great evidence now that if you treat psoriasis, that you reduce the frequency of heart attacks. In fact, the oldest systemic biologic treatments we have, which are injectable treatments, there are multiple registries with tens of thousands of patients in them, and they've actually shown a 50% reduction in heart attacks. And actually patients live longer. You know, everyone's going to die, but the chance of dying of a heart attack in the next 10 years is literally cut in half on those drugs. And evidence is beginning to emerge on the newer drugs as well that they do the same thing, perhaps even better.
What about the mental aspect of dealing with this disease? How does it affect one's psyche? I know the physical aspects are tremendous, but when you're in pain, itching, have unsightly sores.
Yeah, even localized psoriasis, if it's visible, can be devastating psychologically. There was a study at one point that looked at the psychological impact of a variety of different diseases. And the only disease that came out worse than psoriasis on that psychological scale was severe depression. It was worse than heart failure, cancer, diabetes, strokes. I mean, it really has a profound negative impact on one's self-esteem and is strongly associated with depression. Suicides are increased. But what we see is when we treat the disease, that reverses. You see, there's actually a score that we use to gauge depression, and you can see a dramatic reversal in patients who are treated. In one of the studies where there was a drug that, unfortunately, there were a number of suicides in the trial, and the drug got a warning for that, which hopefully will get lifted because there have been no suicides since. But when they started to see the suicides, they gave all the patients in the trial, whether they were getting placebo or active drug, they gave them this suicide scoring system to do. And the patients clearly who are on the active drug had a profound positive impact on their psychological status. You know, there's very little depression, whereas the ones who got placebo, depression got worse.
Now, with treatment options available, obviously you're not dealing with this skin condition, constantly. What are some of the things that would cause a flare-up even while being treated?
So there are some known triggers. One of the common triggers, which was a real problem before we had the current treatments that we have, was absence of sun. So we would see patients come in every year around end of October, beginning of November, because the summer sun was gone. And sun is helpful for psoriasis. Other known triggers are things like strep throat infections are known triggers. We've reported worsening of psoriasis after getting COVID, worsening of psoriasis after getting the COVID vaccine. So there are a number of factors, but the current treatments we have actually been proven in the vast majority of patients to put patients in remission. And as long as you stay on the drug, the patients maintain that remission for years. Even some of the drugs, if you stop them, the patients get long, durable remissions after the drug is stopped. But eventually, because it's in your genes, we're not curing the condition, we're only treating it. Unless we change one of your parents, that condition is there, and so it does eventually come back.
Are there any treatment methods that doctors are generally very excited about? I mean, there are a lot of treatment options, but what would you say are the go-tos that doctors really, really push?
So we're going from pretty good at this point compared to 10 or 15 or 20 years ago to great. There's some new treatments on the horizon. There's a new injectable treatment, which unfortunately the FDA delayed approval for because of some issue at the factory, but it's called Bimikizumab. Hopefully it will be approved within the year, certainly within the next year. It is available in Europe, Canada, and Japan, and it is dramatically effective. There are 2 new creams just approved that are not steroids. We've always had good steroids, topical steroids, that have been effective for psoriasis, but they have some side effects because they're steroids. So we have 2 new non-steroids just approved for psoriasis, and actually more coming, more in testing, that are just superb. They're as good as the steroids without the side effects. There's a new pill which hopefully will be approved within the next 2 or 3 weeks called deucravacitinib, which has already shown in published trials to have strong both safety and effectiveness advantages over some of the current pills that we have. So we're in a very good place in psoriasis. We're actually doing fairly well and getting even better. In fact, I would say there have been more drugs introduced for the treatment of psoriasis thanks to the National Psoriasis Foundation over the last 20 years than all the rest of dermatology put together. So it's a good time for the field as we've been able to help more and more patients.
Give us a website where our listeners can learn more, please.
Yeah, you can get a lot of help from the Psoriasis Foundation, the National Psoriasis Foundation. It's at www.psoriasis.org. And I will say one of the remaining frustrating things for physicians is we now know we have the ability to help patients, and it is frustrating for us to see patients who are not reaching out for that help. The Psoriasis Foundation is a great place to start.
Mark, it's been a pleasure speaking with you. Thank you so much for joining us here on Health Professional Radio.
Truly my pleasure. Thanks for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Mark Lebwohl, Dean of Clinical Therapeutics at the Kimberly and Eric J. Waldman Department of Dermatology at the Icahn School of Medicine at Mount Sinai. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.